Hi everyone, it's Lori Geiselman. I am here to talk to you about behavioral health and culture. We are now in Module 5. Woohoo! This will be, for most of us, about the next to last class before your presentations. And this will be short. We're going to just provide you a few slides on culture and just to get you prepared for class, get your mind thinking, come with your questions. What myself or one of my colleagues are most likely really excited about this topic, and we expect that you will enjoy it as well. It certainly allows for a lot of great conversation, and we all end up learning from one another. So appreciate your time and your attention to this mini module. So again, we're talking cultural awareness and behavioral health. And why is it important to be aware of a person's culture when we talk about behavioral health? Here's the definition, which may be a repeat of something else you've seen: a state of mental, emotional being, including choices and actions that affect wellness. The reason why this slide is repeated again for you, we want you to realize that culture affects those choices and actions that people make. Behavioral health is important. We consider behavioral health disorders and substance use disorders under that greater umbrella. It's a common cause of disability in the US. And here's why it's significant for us to talk about behavioral health. Annually, about 33% of adults struggle with a behavioral health disorder. That's staggering when you think about it, and it can get in the way of things like relationships and keeping your job, going to school, taking care of their own health, which for most of us, because you're in a healthcare system, that would be why we would care about, this aspect. The context of culture, the greater context rather, and culture is super important when we're considering behavioral health. Disorders are illnesses. Whether it's a medical disorder, a mental health disorder, substance use disorder, we don't define people by their illnesses, right? It's really important. Sometimes with behavioral health, we tend to do that with people. We automatically see their illness when they come through the door. Oh gosh, here comes the lady who has, and you fill in the blank. Instead of, oh, here comes Mary. I've chosen the name Mary today to use as my fictitious client. We need to understand the person to understand the illness, and context is going to provide important information about the person and the illness. It isn't just that Mary walked through the door, but what is it that's going on in Mary's life? Mary's going through a divorce. Mary just lost her apartment. Mary's been homeless and living on the streets. I mean, all of those things, that's context. That's very important. And culture is an important part of that greater context. What are those belief systems? What are the traditions and the values in that culture that person belongs to? When we assess patients or clients, we're looking at them from a biopsychosocial point of view. The whole person, the mind, the body, the spirit, the social, the cultural. Culture's in purple because we want to remember that when we're looking at the social aspect of what's going on, we need to also not forget that culture belongs in that zone and is part of the greater assessment. Culture structures our perceptions and behaviors. It provides us with a set of beliefs, norms. What are the expectations, values that influence our ideas about relationships? Goes down below to say, culture provides us with like the instruction book, how the world works, what is expected of us, what do others need to know to understand us. These are convenient but not always complete or positive. And why is that? I'm going to tell you that we also have ideas about other people's culture that normally will pop right in our head. And sometimes when our beliefs and their beliefs are different, we automatically discount the belief that isn't like our own and tend to think that that's wrong. And so we need to really be introspective and take a careful look and be willing to examine when we are having a negative view of something because it is different from our own belief system. That is something we'll talk about in class, and that's why it's such an interesting conversation, and we all tend to get a lot out of it. Culture is not a single thing. We all belong to multiple cultural groups and attend to many cultural expectations every day. So it could be the culture of my family, the culture of being a mom, a culture of being a part of a particular profession, and they overlap. And we bring our family culture or our personal belief systems into that professional workplace. And so sometimes they don't always jive. Well, we talked about that in a former class, but again, it's about self-reflection and making sure that we are understanding and valuing and respecting a person's culture that they bring to the table. And just because it's not what we believe does not mean they're wrong. Other cultures and subcultures operate within larger cultures. We've got a neighborhood, we've got a family that lives in a neighborhood, that lives in a city, that lives in a state. All have different cultures. Does that make sense? And we're all trying to live together, if you will. Oh my goodness. So look at this laundry list of characteristics. This would be a 25-minute video. If I were going to read them all to you, I won't, but I just want to point out a couple of big ones. Our identity development happens through culture, understanding what celebrations and ceremonies, for instance, are important to us, our sexuality and the roles and the uses of language. Oh, who has the power and authority? Who do we listen to within our family and within the greater culture that we operate in, the society, you know? Gender roles and relationships, the role and status of children and families, support networks. As a provider in a either a mental health or a medical facility, you know, a person's belief around support systems, and if they're willing to utilize those support networks or the relationship that they feel to that. An important one might be, in some cultures, religion is very important and it's a great support network. In others, it's no, not at all. That wouldn't happen. Some subscribe to using say a mental health provider, where another culture might say no, that's like not okay. And we need to understand that so that we can help. Either tapping into the source, such as if I go back and look at the square that says power and authority, who's in charge, maybe I would tap into someone in that family who's in charge, if that's a family that doesn't believe in mental health treatment, for instance, and maybe see if I can meet with them and the patient to make that okay for that patient to say yes to that treatment, but also respecting their culture and figuring out if there's a way to make that okay. Just as an example of how you would use these different characteristics to help the patient. Culture is sometimes applied to groups, and the examples they give are age, socioeconomic status, disability, sexual orientation, health status. We see that all the time, and that's also a part of my culture. I belong to some of these. Maybe I belong to you know, an age category, or I belong to a sexual orientation category, right? And whatever one you fit into, that becomes part of your greater culture. But we have to be careful, because sometimes we label and make decisions and make assumptions about patients or clients because of this greater group that they belong to, such as someone with a disability, or someone of a certain age. Okay. Now, culture. Also, we need to understand that individuals embrace culture in unique ways. We all grew up in a certain culture, but it's very likely that every individual in your own family, for instance, is a little bit different in how they internalize and utilize that culture in their own lives. And we have a lot of diversity also within and across races, ethnicities, and experiences. So for instance, if you go down and say where it says, what do you really know about a person who's Hispanic, 90, Native American, military veteran, gay, it doesn't, you can't stop there and say all 90-year-olds are exactly the same, because they all have disparity or diversity rather around the race and ethnicity and their own life experiences. And so we got to be careful not to have a specific thing pop in our mind around if I ask myself, what do I really know about a person who's a military veteran? Well, maybe for some of you, Rambo popped up. Well, they're not all Rambo. And so there's just so much more to know about a person. We know there are disparities in behavioral health, and it impacts how they access care, if they can access care, the care they receive once they do access our systems. Some of the disparities that we see are important for us to understand, because we're the ones that need to confront this and help clients also when they let us know that they're having these experiences, or if we see it for themselves. So where are the disparities? Where there's different racial and ethnic identities, the LGBTQ populations, people with disabilities, adolescents or young adults, other vulnerable populations, seniors. When I see seniors, oftentimes it's really difficult when an MD, for instance, might say, oh, we need to call their son or daughter. I need to talk to them about blah, blah, blah. And then I'll say, oh, do they have the ability to make their own decisions? So I'm asking, if they're very altered, or are we dealing with extreme dementia, for instance? Well, no, but I'm not sure if they can care for themselves at home. Well, did you ask them if they feel they can care for themselves at home? That's just an example, and to me, that's a disparity, and that's an obstacle to the type of care that every person deserves. Here are some factors that also will cause these disparities. Lack of access, things like you're not eligible for insurance, lack of diverse healthcare workforce, a lack of information. Maybe it's information in your own language, not being able to access interpreters or people who speak your language, and you don't want to go through an interpreter. Lack of cultural competence. We're going to talk about cultural competence and what that means in the next webinar. So I'm going to kind of gloss over that one. And when organizations and staff don't possess and make use of cultural knowledge, this is what happens: less help seeking, poor communication, misunderstandings about a person's own health needs or their illness. That's a dangerous one. People really need to understand. We can't just hand them a piece of paper and say, oh, you go take this medicine, do you understand? They really need to know. Treatment delays can happen. Quality of care problems exist. And there can be negative health outcomes if someone clearly doesn't understand the nature of their illness. Now, culture in healthcare contexts. We have people, and I want you to again think about what pops into your mind when you hear these expressions. People who are Hispanic, people who are single, people who are gay, people who are female, are widowed, are lonely, are in recovery, are Catholic, people who are, and you fill in the blanks. Within the healthcare context, we have our own staff that's very diverse and has a lot of different cultural aspects. In assisted living, we have systems that have like a systemic culture. and our clients who have their own. And so now it's as if we're all overlapping one another and trying to operate in such a way that the best outcomes are occurring. Understanding that culture is such a great part of those good outcomes. And I think that's all I've got for you. Special thanks to Professor George Ladd at Rhode Island College, who developed this greater PowerPoint. I pulled this from the one that we'll use in class. Please don't forget to take your quiz. There'll be one more mini webinar on cultural competence and just what that means that you will also be viewing before coming to class. Thank you again, and looking forward to seeing you soon, or you'll see one of my colleagues. Either way, thank you so much for your participation.